This morning on Today's Health, answers to some of your most embarrassing health concerns, from excessive sweating to excessive hair growth. It can be kind of awkward to ask your doctor about these things, but it actually could help you detect an important medical issue. Board-certified internist Keri Peterson is a contributor to Women's Health magazine. Good morning, Dr. Peterson.
Good morning, Savannah.
Well, first of all, let's just make a pitch to everyone out there. If you've got some embarrassing problem, don't be shy. Go to your doctor. You guys have seen it all, right?
We have. We've been there. We've done that. We've heard everything. So please ask us if something's concerning you.
All right, our first embarrassing issue that a lot of people struggle with: excessive sweating. Why do some women start sweating profusely?
When you excessively sweat, it's from an overactive temperature regulation system, and it's called hyperhidrosis. It affects about 3% of the population, and typically what you see is very wet palms, soles, and armpits, and it can be really embarrassing for people. Like, imagine if you're shaking someone's hand and it just slides off.
You don't want to be too clammy.
Or if you're public speaking and your armpits are wet.
Not to mention the dry cleaning bills if you have this issue. You said that Botox can actually help some people with this?
It can. Isn't that surprising? What Botox does is it relaxes the sphincter muscles of the sweat glands, and it's very helpful in the armpits. I actually do it on my patients in my practice, and it can keep your armpits completely dry for up to a year.
Any other forms of treatment you recommend on sweating?
You can have prescription antiperspirants. There are also medications, and there's actually a device called iontophoresis that works well.
All right, incontinence, also a concern. So some younger readers, first of all, why would women be suffering incontinence at a younger age?
That is surprising, right? Most people associate incontinence with the elderly, but younger women who have given birth vaginally can also suffer from incontinence. And it's because when you give birth vaginally, the pelvic floor muscles sort of expand and relax, and then the bladder falls, and you can have leakage when you're coughing or jogging or sneezing.
And you recommend Kegel exercises.
Kegels, that's right.
Oh, Kegel.
And keep in mind that 1 in 5 women don't do them correctly, so go to womenshealthmag.com to learn how to do them properly.
Okay, you can talk to your doctor about that. We won't get into the details there. All right, hair growing excessively on the body in unusual places. What is the deal there?
Well, first off, if you notice you have excessive hair growth, look at your mom and your grandmother. If they have it as well, it's probably genetic and nothing to worry about. But if you're having new onset hair growth, or if your family doesn't have excessive hair, it could be a hormonal imbalance. Okay. And the most common one is called PCOS. Associated with that is acne and menstrual irregularities, so that may be you if you have that whole triage. Also, tumors of the adrenal gland, of the ovaries, and an overproduction of cortisol can also do it.
So if you have this symptom, don't be shy. You should see your doctor because it could be more serious.
Yes.
All right, next one on the list: drooling. I happen to know a lot of very nice people who occasionally drool when they sleep.
Right?
Yes. So why do people drool, and what can you do to stop it?
When you sleep, your muscles relax, your mouth falls open, and if you're lying on your side, it's going to leak out. And did you know we make 1 liter of saliva a day, by the way?
No.
That's a lot. So also, if you have sinus problems or allergies and you tend to mouth breathe, you're going to be more likely to have this happen to you. Okay. So sleep on your back.
Oh, well, that's a simple solution. All right, bad breath. Sometimes this is a symptom of a more serious issue.
It can be, and the one that's most concerning is called gingivitis, which is gum disease, and that's linked to heart disease, so it is something to be aware of. So floss really well, get into those crevices, do it every day. Other causes would be the tongue. The tongue can harbor bacteria in the back, so when you brush your teeth, be sure to scrape the back of that tongue as well.
Okay, and our last on the list is a lot of people have joint noises. So they're out, they're exercising, and their joints are making all kind of creaky noises. Why would that happen? Yeah.
Now, that popcorn sound is called crepitus, and that's when the joint surfaces are irregular and they rub on each other. And it's typically from an injury or from arthritis. So if you have that, definitely see your doctor.
Okay, and is there quick fixes with that, or is it you just want to see the doctor, see it might be something more serious?
Correct.
All right, Dr. Keri Peterson. But the bottom line is that you shouldn't be embarrassed because lots of people might be suffering right along with you.
That's right.
All right, thank you so much.